Hi, I'm James Spillane. I'm here in beautiful Kenai with some folks, and they're hiding around the room and stuff. We're doing the GPRA measures, and we're going through one by one. We've kind of are working on the health bundle right now. One of the ones we're going to want to look at is we're going to look at GPRA Depression. Now, this is an important one. This is a GPRA MA measure, so this is one of the four ones that they report to HHS. So let's take a look at this and kind of like dig in on it a little bit. So what GPRA is looking for is active clinical patients ages 18 and older broken down by gender, right? And how do we meet that? So basically, to satisfy this measure, patients screened for depression or diagnosed with mood disorder at the time during the report period. Refusals don't count for this. Also, if they've had basically a diagnosis for depression or an education within the last year. So that's how we're going to satisfy this measure. So when we come into EHR, we're going to come over here after we pick a patient and we pick a visit. We're going to come into the Wellness tab, and we're going to come over here to Education, and here is your depression screen. We're going to go ahead and select it, and we're going to enter the results, positive or negative, of that screen. And you can also enter historical, so if the patient's had one elsewhere, like A&MC, we'll enter it there. So now I'm going to say OK. So that will satisfy that measure. But also, let's look at an education. We should be able to come up here and find something somewhere. You can come in here and we can do literature per se, or we can do disease process. We'll do select, 2 minutes. Both of these are two things in the Wellness tab that can satisfy that. Now, let's say the patient does have their positive result and then they actually get diagnosed. This will also, of course, since you've already done the screen, but a diagnosis somewhere else entered into the system will actually satisfy that measure. So that's depression. I hope this helps. Thank you.